Good morning. Welcome back to the Broadcast Retirement Network. This is BRN AM for Tuesday, July 16th, 2024. And our top story today, what ailments lead to the highest medical claims? And joining me now to discuss this and a lot more, Lisa Hundertmark is with Sun Life. Lisa, so great to see you. Thanks so much for joining us on the program this morning.
Hi, Jeff. Thanks so much for having me. I appreciate it.
Yeah, and I love that we're going to be talking about claims, and I love the fact that you have a nursing background. I mean, that's fabulous. And I think it gives you, I guess my first question, it probably gives you really great context, actually having been a provider of healthcare services to so many. Now you're looking at it from a risk perspective.
Yeah, it's been an interesting 25 years. That's how long I've been kind of in this space, helping to help employer groups, help our clients really understand what's happening when it comes to claims, why they're so expensive, why we see trends. So it's been a really great use of both my nursing background and then also I also have an MBA, so a little bit of the business background as well.
Yeah, and this report, absolutely fascinating. Let's start with, I want to start with disease, because everyone that I talk to, and presumably a lot of people that you talk to, disease in America going up in terms of, cardiovascular disease, diabetes, over people that are overweight, cancer. How does that translate to claims within employer groups that your firm works with?
Yeah, so it's a great question. And it's actually the whole purpose of this report, right? So 12 years ago, we decided it was time for us to kind of help our clients by providing data on which claims were most costly, see whether or not we could see trends, and then hope that that information could be used by our clients, which are really employer groups, to help kind of navigate where do I need to go? What do I need to do? How do I support my employees to first avoid risk, but even more importantly, to make sure that my employees are grabbing access to care. Became really easy in my 25 years ago when I started in this industry. It became really clear to me that the number one way to avoid risk when it came to healthcare was to provide the best quality care. I mean, if you have good quality care, if you're accessing care where you should, it's the most opportune for your employees, then you're actually going to mitigate risk. There might be some front cost, but in the end, quality care equals less risk. So if we go back to your questions about diseases, one of the things that our report has shown to us is that there are top 5 categories that really are the most expensive for employer groups and for members, if you will. We always see cancers, both the blood and the solid organ cancers, as usually a 1 or 2 or maybe 1 in 3. This year it was 1 in 3. That's really very clear. You have cancer is being treated very well these days. There's a lot of innovation in that space. We've come a long way. We treat cancers now a little bit differently. They're almost as if they're chronic diseases once you get out of that acute phase. So you see care going on for longer periods of time. And so it's not shocking that that would be, a costly type item for an employer. Some of the other areas, cardiovascular, which you brought up, is another really interesting space that we're seeing an increase year over year in people in that realm. You had mentioned obesity and health concerns. That is one way that employers and people can help mitigate those risks, right? Quality care in those areas. But I think another thing that's coming out of it could very well be that we're also seeing baby boomers staying and working way longer than they had in the past. And so are we seeing an aged population when it comes to employers? They're keeping on people longer periods of time. We saw during the pandemic that individuals are now able to work from home. It kind of comes across as like, maybe I'll just work a couple more years, why not, right? It's kind of easier than it had been in the past. And so there's a chance that we are seeing some of those numbers increasing because just the population has changed. We're seeing, people of higher age, in the workforce. There's also the pandemic itself, right? COVID does have or had some inklings of cardiovascular issues with it, more so than I think we originally thought. I think people saw it as a pulmonary disease. You got the flu and you had your cold and you felt like, this is the lung problem. And what it really is a cardiovascular issue. So there's some of that probably creeping into our numbers as well. But as you can see, when we talk about these things, it's the whole purpose, right? We need to take a look at what's happening and then analyze why it's happening, and then try to come up with ways to mitigate that risk or help our members get better care so we can kind of avoid that risk and optimize that treatment.
So if I'm offering healthcare benefits is probably number one or number two for an employee coming to work for a particular employer. Are there things that employers can do to stimulate or incentivize people in order to bring some of those risks down? And I point to, we were talking before about obesity, going from chronic to preventative medicine. But are there things that employer groups are doing because they're looking at that cost side and saying, hey, if we're going to have to pay more, if we're skewing because of these older groups, we're going to have higher diseases. We need to figure out a way.
Yeah, I think you bring up a really good point. Like, I think what we are seeing and why, the industry in which I work is self-funded, and self-funded employers are really kind of managing their own plans. What is it that my employee is going to get when it comes to care? What is it that they're going to get when it comes to benefits? And they want to have a little bit of control on that. And I think that's my number one recommendation, to be honest with you, is having your plan open to providing care that might come up that you're not really maybe normally would have seen or been prepared for. Having it being a little bit more loose to, bringing in additional resources, vendors outside of the network itself to kind of help you in those key areas. And I think too, another thing that an employer group should do is really analyze their demographic. What is it that is happening? Like, if that employer group has a particular demographic, say it's a school district, and they know that they have more of this than that, they have an age group that has children, they might have whatever it might be. I think that's another key area. And then you can target into the disease processes that align with those demographics. And I think that's another important thing. As consumers, I think you brought up some really great points. You should be looking at your benefits wholly. You should be talking to human resources about what is out there. You should see whether or not there might be affiliated apps that your organization uses to kind of steer you towards benefits that are good for you or capable for you. Whether or not, I don't want to name particular names, but there's some out there that really are wellness promoting types of organizations and apps that are out there. Use them, look into them. Figure out whether or not there's something out there that you can do as a consumer of medicine that can help you manage your health overall, and then hopefully avoid some of those higher cost claims that we see.
Yeah. Well, Lisa, I need to take a very quick break. When we come back, we're going to talk more about mitigating healthcare risk as an employer and also as a consumer. You're going to want to stay tuned right here on BRN AM. Now is your opportunity to co-create content around any topic on the First Lifestyle and Wellness Network. Reach a global audience through our platform and co-own exclusive branded content. All of our programs are available on demand and also as audio-only podcasts, so you can take us on the go. Broadcast Retirement Network, available anytime, anywhere, and on any device. Well, Lisa, thanks so much for staying with us. Really appreciate you hanging around for segment number 2 this morning.
Yeah, thank you again. I appreciate being here.
Yeah, and there's a lot of great information in this report, and people can certainly check it out. We'll have the link posted below. But let's talk about, I want to ask you about mental health and where that kind of fits in the numbering of diseases. Because I kind of think of, post-pandemic, all we have been consumed by, we've been consumed about obesity and weight loss and weight gain, all that kind of stuff, obesity. But mental health has been at the top, at least in terms of what I read in the press. So from your perspective, in terms of looking at the data, where does it fit?
Yeah, it's a great question. And I think it's important to say that I actually feel like it's one of the benefits of COVID. One of the benefits of COVID is it took us a chance to step back and realize during that time period that people's mental health really played and impacted on all the other conditions that are out there, right? It's the first time that we said, let's take a step back. People are working from home. They're not seeing family. Like there's obviously increases in depression. We're recognizing it. And I said to myself, it's one of the benefits, right? Because it did put it on the map. You said it yourself, like since COVID, right? It kind of put it on the map for everyone to really kind of hone in on. And I think it is very important. For us, it did have a spike during COVID itself. We saw that in our prior reports, and there was a spike. And in particular, alcohol use was one of the noted areas during COVID and which again, it's probably not surprising when we take a step back and look at it, right? And we say that could definitely have happened. People were at home alone, and had those issues. What I think it does now is you might not see it on our report as being the number one diagnosis for any of our large cost. Remember, what we're looking at is really the most catastrophic of injuries and issues. So, but what you will see is it does interplay with that. If you have depression or anxiety, your willingness to go and seek care might be altered. Your ability to follow the directions of treatment might be altered. And so I think it's important, and I think one of the takeaways from COVID was that it does play an integral part in some of the worst cases and worst diagnoses we have. Cancer comes to mind. When someone has a diagnosis such as cancer, you can imagine that they're not thinking about life in general, right? Like my life expectancy, what's going on, what is my family going to do? How does this impact my income? There's just so many things that people are thinking about. And I think it's really important for us to hone in on the fact that if we're taking care of the mental health during that crisis, we're really taking care of the member holistically. And we really are going to have a much better outcome because they're more likely to follow care needs. They're more likely to follow up with physicians. So for us, it might not be on our top 20 per se on any given year, but we know that it plays a very important part in really high cost claims and the outcomes.
And, Lisa, and it'd be interesting to get your perspective because you were a healthcare provider. Over the last decade, 2 decades, American healthcare has improved. I mean, there's all these new techniques. I think with the exception of COVID, the COVID years, our longevity has improved. So there are amazing treatments. And in fact, the way we treat diseases today is very different. I mean, we're treating them actually better. And I guess, and I'm just saying this anecdotally, by treating things better, we're able to actually reduce costs.
Yeah, I think it's probably twofold, right? So yes, you're absolutely correct. We are seeing advancements in medicine. When advancements in medicines first come out, they're usually pretty costly. We see that in high cost IV medications that are being provided right now. I always joke, you can't watch a golf tournament with not seeing some type of IV medication being provided, right? There's commercials for it around every turn. Those medications when they first come out are really costly because you have to pay for the development of those medications. You have to realize that those medications are usually for a select group of individuals with a very particular diagnosis. Cancer is one of those areas, but you can even think about things like MS and some of the diseases like Crohn's disease and whatnot. You'll see those on TV quite a bit. So they're expensive to begin with. Yes, people are getting much better care, but the cost has risen quite a bit because of that advancement in medicine. We also see advancements in things like, in particular, we see a lot of congenital anomalies with babies. And so the care that's being provided is profound. I mean, as a nurse who practiced medicine, I remember way back in the day that a lot of times, unfortunately, these babies would succumb to whatever congenital anomaly they had, or the diagnosis of those was late and maybe things would happen to the child and maybe their outcomes weren't as good. But again, that care cost quite a bit. And so it doesn't mean that there aren't ways for us to manage it, because I think there are, right? So if you think about congenital anomalies, for instance, since we're just on that topic, getting good screening while you're pregnant, making sure that, the child is going to be delivered at a place that can care for it if there's a congenital anomaly. Those are really important things to do ahead of time, proactively. Get them the care to be happening where it needs to happen. And so Yes, I agree with you. Advancement in medicine could mean in the future things would be less costly. There are always benefits to having those advancements. You know, acute hospitalizations go down. You know, issues with infections and things like that are less when we have good quality care. So we do see it on the other side. But unfortunately, very early on, you know, there is a large cost for some of these really amazing new treatments that we're seeing.
Yeah, when you think about the R&D, it doesn't just come about after a month, a month of work. It usually takes years and years and years. Uh, I want to go back to, maybe just a key takeaway here for in the remaining minutes that we have in terms of mitigating costs. First, for the employer, and is it about helping incentivize employees to be proactive? And when I say proactive, getting the checkups, which are generally covered by most insurance policies, healthcare policies. I mean, is it as simple? Does it sound simple? But is it really as simple as incentivizing and reminding people to take advantage of some of the screenings and things that are available to catch things earlier? If you catch things earlier, you bring down your spend.
Yeah, yes, absolutely. We should be incentivizing and or encouraging everyone to go get the care that they need. And to your point, a lot of times it's covered 100%. What I will say though is, and something that we'll need to keep watching in the forefront is that we talked a little bit earlier about maybe providers are not available. Access to care is getting harder and harder, right? We know that the industry, healthcare post-pandemic, has not enough physicians and not enough nurses and caregivers out there. So what do? I think we open ourselves up to alternate forms of access and care. You know, if it's in the home, if it's telemedicine, when we say make it easier for the consumer to get medicine, I think that's at every level, right? It's not you need to go see the PCP that you have and you see every year on your annual visit. Maybe it is we have telemedicine options. How about that? How about a clinic at work? Is there a way that I can bring, access to screening for blood pressures and maybe even, glucose monitoring and things like that at a workplace? Maybe that's something that we need to do. I think we're going to need to think outside of the box if we're going to deal with this access issue that that we currently have, and it's only going to get worse with time.
Well, I certainly think that human resource officers, chief financial officers, I think they're probably would agree with you, and they probably want to think proactively in consultation, of course, with firms like yours. Lisa, we're going to have to leave it there. Great to see a great report, and we look forward to having you back on the program again very soon.
Thank you so much, Jeff. Appreciate it again.
That wraps up this episode of BRN AM. Have a topic of interest, someone you think we should talk to? Drop us a line, and don't forget, for all the latest curated news and lifestyle, wellness, finance, tech, so much more all in one place, check out today's edition of our daily newsletter, The Morning Pulse. Want to search our archives, check out our latest content? Well, then visit our website. Hey, we're back again tomorrow for another edition of BRN AM. We'll have a very special guest and another important topic. Until then, I'm Jeff Snyder. Stay safe, keep on saving. Don't forget, roll with the changes.